Welcome to another segment of our Partner Spotlight series, brought to you by the members of the Regional Chronic Disease Collaborative. The Regional Chronic Disease Collaborative members work together, combining their resources and expertise to help prevent the development and progression of chronic disease across our region. Our Partner Spotlight initiative is to help share innovative approaches being used throughout our region to improve population health.
So welcome everyone. I would like to introduce you to Cristine Braddy, who is the director with the Goshen County Public Library located in Torrington, Wyoming. She is here today to share a little bit about the Public Access Telehealth Booth program. Now to start us off, why don't you share with us a little bit about the program, or just an overview of the Public Access Telehealth Booth services and how the library became involved in this project?
The past telehealth booth, our Public Access Telehealth, was created to provide access in rural areas. Torrington is incredibly rural. We have a population of 6,000. Our county has a population of 13,000. Our closest large hospitals are an hour and 15 minutes and 2 hours away. So this is an important piece of the puzzle for our community.
Could you share now how this program was developed or initiated, and more importantly, why?
Really, this program came out of an understanding of the mental health needs in the state of Wyoming and providing access to mental health providers. That's the beginning of this program, which has developed into broadly providing access, because mental health is not the only thing we don't have access to in our community. But the program began recognizing that there is limited access to specialists, there's limited access to mental health, there's limited access to people because we don't have transportation. Goshen County is one of the counties that we have no public transportation, no way to get people from Torrington to Cheyenne or Casper. Not a bus system, there's just no transportation. So unless they can find somebody to take them, they're really limited to what they can get here in Torrington. So this telehealth program was created so that people can have access broadly to the specialists that they need. So the Department of Ed jumped on that through one of their mental health professors who was really passionate about providing mental health broadly. And then WIND, which is the Wyoming Institute of Disabilities, got on board. And that's kind of how the program initially began.
In addition, would you be able to share what your initial goal for this program entails at the Goshen County Library?
My initial goals were, one, to provide access. I think that's one of the things that in libraries we just do. We provide access to information. We provide access to technology. We have broadened that into other things, providing access to gathering spaces and then providing access to medical care. So that was our first initial goal. But the other part of that is our library does not have a meeting room or a quiet space. And we started having people during the pandemic and following the pandemic who were asking for spaces where they could do their telehealth appointments. Most of our patrons that needed access also needed instruction and needed somebody to sit alongside them and help them get into the technology. And so this booth provided a quiet space with access that is easy. We can get it all booted up for them, and then they sit down and do their appointment. We walk out. As private, as confidential. They can do it without needing to try to juggle all of their iPads and phones and laptops that they don't really know how to use.
Very nice. Now, more specifically, what are some of the key goals of the program in which you and your team focus on directly to assist in improving your community?
So we focused on communication and health education really broadly, primarily blood pressure, cardiovascular health. That is where we really focus. And taking that education into our senior center, taking education over to resource fairs, and then communicating when we see parents and grandparents bringing their kids. In that cardiovascular health, we also have led some hands-only CPR classes. So just really trying to get our community connected with needs and cardiovascular education. With that education piece, we want to make sure that the members of our community are able to reach out to the specialists that they need.
And to my understanding, you and your team work in conjunction with other programs and organizations.
Yeah, so the big starting point, of course, was the Department of Ed and Wyoming Institute for Disabilities. But then from there, it more broadly has gone into the Center for Aging. So they have provided us with blood pressure kits. Every library in the state of Wyoming has blood pressure kits for checkout to their community members. So we have blood pressure kits. They've also provided other things like scales and full socks and that kind of stuff to have in our telehealth booth, so that if a provider needs more information from the patient that they're seeing, that patient has access to those things that they can give those parameters for. We also have been a part of a learning collaborative and making sure that we are really providing education, again, on cardiovascular health. We work with the American Heart Association in hosting a Heart Corps member here at the library. And that Heart Corps member's job is to do all these education pieces for us, to go to the senior centers, to go to resource fairs, to go to any community event and provide that education, as well as to teach the hands-only CPR and assist patrons in using the telehealth booth.
Would you be able to elaborate on any metrics or data points you're monitoring for this program? For instance, how many individuals have utilized the program since inception?
So we do measure how many people use it, how long they're in the booth itself, and whether they use our equipment or they bring their own equipment. We are averaging about 2 patrons a week, which is not, maybe sounds like a really small number, probably if you're in a larger area, but for our population size, I feel really confident that that is people who are getting out there and understanding the program. So we measure that. We measure whether they use it for a medical appointment or something else. So we have had people ask if they could use it just to have a quiet Zoom location. Medical also always takes precedence. So if somebody scheduled it for a doctor's appointment or some other thing, we've used it for enrolling in health insurance. Enroll Wyoming has helped us use it to get people access to their services. So that always takes precedence over something else. But our average is about 2 patrons a week, averaging about an hour in the booth. It takes, some time to get set up, have your meeting with your provider, and then clear out. Most of those patrons are using it as a follow-up appointment. We don't gather any information on who they met with or why or that kind of thing.
Would you be able to share who is utilizing the telehealth services at your location?
I would say that our demographics are mostly older adults are using the services, which is what we anticipated. We had someone get really excited when they realized that they didn't have to drive to Cheyenne for their follow-up, but they could just come down to the library. So that's a big deal. And that is why we push really hard with the senior center, because we know that that's probably our primary. The other interesting demographic to me is a lot of follow-up with younger kids to Denver Children's. And so that has been an interesting demographic parameter. And we know specifically kind of they're working with them because of that needing to have a Wyoming license. And so they are working with those providers, and they're able to provide follow-up services or healthcare here through the telehealth booth.
Now, what results or changes have you experienced within the community associated with these added telehealth resources?
I think one is just people feeling like they can access stuff. Nobody likes to feel like that is something I need, but I can't get. That doesn't feel good to anybody. And so I think for people to feel like confident, there's a space that I can go, that I can use so that I can access the medical healthcare that I need. That's one. I think the other is feeling like you're not alone in this. So instead of trying to fumble around, I have a technology educator who works with older adults every single day to help them on computers, doing whatever it is that they need to do. But then he's also available for them to help them get set up for their appointment. And that just instills a confidence in them. Like, I'm not going to be stuck in here alone, not able to do what I need to do. And because he is a trusted resource, because he has worked with so many of these people before doing other things, I think that has been a great asset for these people to feel confident, to feel comfortable, to get the healthcare they see. Like, of course, what I would love to see in the future is that you would see our numbers for people with high blood pressure go down, our numbers for people with other cardiovascular health issues go down. I would love to see, we talk a lot about numbers with diabetics. I'd love to see those numbers go down because we're providing access to those resources. I don't think we've done this long enough to see that yet, but that would, like, ultimately in 5 years, I would love to see that this has had a huge impact on our community and its health.
What is your role within the program at the Goshen County Public Library? And what advice do you have for others who may attempt to implement a program like this one?
My role is, one, to sit in meetings and on our collaborative and to talk about what we're doing, what we're seeing, how this is working. I have enjoyed that only because we are kind of out in the middle of nowhere, and so the people in our community have loved having access to this. My other role is the administrative side, making sure data is kept, organizing my staff, making sure that they understand how to use the booth, that everybody is well trained so that when somebody comes in, there's no question about how to use it, how to get into it. My role, because we are a small library, tends to be the problem-solving side. So what happens when the electricity goes out and it locks down the booth? How do you figure that out? You know, those kind of things. So that's been a fun little problem-solving adventure. And then additionally, because we are a small community, is making sure that education is getting out there, that all of our providers are very well aware of this, that our representatives are aware of this, that local government is aware that this exists, and that the resources are up to date.
Now, what aspects of the project are you most proud of?
Well, I am proud that, one, we're one of a few in Wyoming that has this booth and is actively seeking to provide access within our rural community and actively seeking to be a part of people's lives in real and meaningful ways. And of course, one of the most real and meaningful ways that you can be a part of somebody's life is when they're dealing with health issues. And so being a part of that, making sure that it is a private and confidential space. So that's really important to us, that this is just as you would walk into a provider's office. And so that's something that I'm really proud of, is our staff has worked through that and provided the resources, the assistance that people need, and maintained that protected space for people.
So overall, what is the process for an individual to utilize this program? Are there fees, certain steps to access the equipment?
So of course, for us on our end, it's free, but they have to, with their provider, work out what that looks like as far as what insurance covers and what doesn't. And one of the things that is wonderful in our community is, for most of our people, if they're employed by any of the larger employers, they do have access to mental health and telehealth resources through their insurance. So that's been great to try to tap into for people. If somebody wants to use our booth, they call and schedule an appointment, or they can there's a form where they can schedule their appointment online through our website. And then we just ask them to make sure that they have connected that with their provider. They know what they know how to get on with their provider. So we have a lot of our older adults who do come and do a practice session with us so that you feel comfortable and they're not late. We don't ask them to do that, but so many of them have asked, can I come in at an earlier time and make sure I know what I'm doing? We make sure the computer's booted up for them. It is a key code access, so nobody can walk in on them while they're in the telehealth booth. And so we get them set up with that so that they know that they're in a safe and protected, confidential space.
And to close this out, where can someone find more information regarding the services offered at the Goshen County Public Library and ways to connect?
They can go to our website, goshencountylibrary.org, or Facebook. We have a very active Facebook account as well that lists all of our events as they're coming up. But the website, of course, is the best place to get events, also just more information and blogs about what we have going on here.
Again, thank you, Cristine. I wanted to thank you for your willingness to participate in our Partnership Spotlight segment. Thank you.
You're welcome. Thanks for having me. I appreciate it.
If you are interested in sharing your innovative approach, please contact one of these Mountain Pacific representatives. Thank you so much.